So we know in the trauma world that up to 40% of our cases that come in are related to alcohol. So either deaths or trauma-related non-life-threatening injuries. So quite often, patients don't even realize that they might have addiction issues or at risk of addiction. We started the initiative with a few seasoned nurses on our unit that had a passion for helping patients with addiction. And from there, their goal was to educate 100% of our staff and screen our patients in surgery and trauma. The screening tool that we use, we just ask them two simple questions. Do they drink alcohol, and do they use street drugs or illegal drugs?
It can be just when you're assessing the patient, doing regular vital signs, that you're talking to them, and a patient might just admit something, or you may have a moment where you could bring up the subject. Some people were eager to seek help immediately, others would just ignore the questions. But we're always pursuing it, so that hopefully near their end of discharge they may think twice about the questions and may still consider help.
As the social worker who typically would become involved at some point, making it an accessible conversation to have and making it more likely for the patient to open up or to express the areas that they're needing assistance with. So really I tried to let the patient drive the focus of the conversation, and it's just seeing where they are at that moment and what they're feeling that they're requiring.
The patient is in agreement for support for the addiction or substance use. It does affect the care plan in such a way that we'll incorporate that with other therapies and treatments that they require while in hospital.
We always saw trauma as injury. We had to look at trauma as a bigger picture, like traumatic experiences as a child or a young person, or in general traumatic experiences and how people cope, what kind of supports they have.
Oftentimes we have patients from out of the city because we're a regional trauma center, so it's finding resources for patients sometimes in smaller communities, or letting them know about some of the OHIP funded rehabilitation sites and what that process involves.
We have noticed that a few of the patients are quite relieved that there's that offer of help over and above their physical trauma or other injuries.
I think how this program has benefited my interaction with patients the most is that it has started the conversation early, and it has sort of destigmatized the future conversation that I will be having with patients.
We want to send them back into their community, but we want to reduce the risk of them returning to us because of either a traumatic injury or other alcohol or drug-related illnesses. So it's that whole population health model.